Well, good morning, everyone. Welcome to another edition of Three Plastic Surgeons and a Microphone. As always, I am joined by Dr. Sam Rhee in Bergen County, New Jersey. God, I'm Paramus, New Jersey. Sorry. Dr. Sal Pacella in La Jolla, California, who's at San Diego plastic surgeon. And today we have the great fortune of being joined by Dr. Chris Costa, who's an incredibly busy aesthetic surgeon in Las Vegas. Before we get into the meat of the program and we introduce Dr. Costa, we'll just do the necessary disclaimer. Pacella?
All right, here we go. This show is not a substitute for professional medical advice, diagnosis, or treatment. This show is for informational purposes only. Treatment and results may vary based upon the circumstances, situation, and medical judgment. After appropriate discussion, always seek the advice of your surgeon or other qualified health provider with any questions you may have regarding medical care. Never disregard professional medical advice or delay seeking advice because of something.
Great. So for our listeners, I've had the great pleasure of knowing Dr. Costa for many years, as has Dr. Pacella. I've known Chris since he was a resident at UT Southwestern. And even back then, it was really clear that he had a great eye and a great mind for all things aesthetic surgery. Kept in touch with him over the years, and he's shared his philosophy to me. I've really been struck by, one, his results that I'm seeing online that are fantastic in so many different procedures, whether it's plasty, liposuction, body contouring, breast surgery. He seems to do a great job with all of that stuff. But he's had an evolution. He's done some things that are philosophies to things than I do, and that many others as well. But his results speak for themselves. So it's been really awesome to sort of keep up. So what we've decided would be a great topic for today is high definition liposuction, because every time I go onto Chris's social media, I see yet another amazing result after another amazing result. And so, Chris, I guess for our listeners out there, first of all, welcome to the show. And second,
yeah, thanks.
What is high definition liposuction? That term being bandied around a lot.
Right. Yeah, no, that's like all the buzz on social media now. I think no matter where you turn, everyone's saying high def, high def, high def. What I classify high definition liposuction is, we're doing more than removing. So from the traditional sense of liposuction, where, your mom's liposuction from 10, 20 years ago or whatever, it's just like the focus really was on volume reduction, right? So like just get the out, and then you fit into your jeans. And there's definitely like nothing wrong with that. Where the term high def kind of comes into play is where we are looking more at your natural anatomy and trying to the contours that you already have and just kind of bring them out and kind of tell the story that you're trying to tell people on the outside, right? So like all plastic surgery, but like the people who do really, really well are obviously, it's like the people who are in the gym, 3 to 6 days a week, and they're just like, man, I just can't get any sort of like result, just because of genetics or whatever it is. So, just try and help bring that out for them. And so there's varying degrees, right? Because like the person who maybe has a BMI of like 20 and works out all the time, they're going to be maybe coming to me with different expectations than maybe somebody who's had 2 kids and they just kind of want their old form back. You know what I mean? So it's always a conversation, and there's varying degrees of it. Most of my patients actually come to me ironically saying like, hey, like just, I don't want like a 6-pack or anything crazy like that. Right. Like people just want to look natural like that. Right. So I think, we use high def because it like people kind of know now, like, what's out there, and they know that what that term means. But it's just about like all plastic surgery, whether you're doing rhinoplasty, breast augmentation, like the goal is to make people's heads turn and be like, whoa, they look awesome, right? Not necessarily like, whoa, that's some plastic surgery. Like, that's always the goal, whether we're doing body contouring or tummy tuck or breasts or nose, face, for all of us, right?
Right. Well, I think you hit on a couple of really key topics. One, natural. Sounds like more of your patients are interested in looking natural and fit as opposed to looking like they have crazy 6-packs. I assume you're talking predominantly about
Right.
women when you say that. Do you find
Exactly. It definitely is different in the male population, but to a certain extent, right? Like I did a guy in his 60s actually last week, and he was a physician. He bikes. He's an avid biker, and he had 2 orthopedic injuries like last year, where he was basically kind of immobilized and not able to like get into shape. And now he was like, man, like I just I'm 60, whatever. I can't. No matter what I do, like I just can't get any definition back that I had before. And he's like, I'm not trying to like look like Captain America. I just want kind of my own old form back, and somebody who can kind of make it look without making it look kind of like that Van Gogh painting where it's kind of amorphous or something like that. So, but for the most part, probably like the same thing you guys see in your offices. Like anytime someone comes in for a breast augmentation, well, I'm in Vegas, so maybe my patients are a little different than your guys's, right? Like, I know my average size breast implant may be a little bit larger than it is in Dallas. But the patients that come to me, they're all like, I love your results. Just don't make me look like I got 2 volleyballs in my chest. Like, don't give me that plastic surgery look. So it's the exact same thing with lipo and, with all that kind of stuff. So I think that's definitely something, when you're trying to learn like a technique in a new procedure, the pendulum can shift like too far the other way too, right? Where you are giving the patient something that it crosses the line of like a natural looking result. And now they look over operated or just over resected or, that kind of thing. So it's definitely tough. It's definitely a balance. And it's taken a lot. Totally different from what I learned in training. So
let's kind of walk through the process then of a patient who's coming in for a high definition liposuction consult. Guys, interject as you ask questions as well. So let's say you have 3 patients that are coming to you. One has a BMI of 20, one has a BMI of 25, one has a BMI of 30. And they all tell me, Dr. Costa, I want to look athletic and natural. Does your conversation differ with those patients in terms of what the results might look like? Or is it the same conversation with all 3 patients?
I think that's a really interesting, because the way you're asking that question, kind of puts a lot into context of, I think, the way a lot of plastic surgeons think about this, and maybe even patients of like, oh, well, if my BMI is this versus this versus this. And I know that's a very like structural way to think about patients. The way I have every single one of my body contouring consults is I say, the equation to getting you the result you want has 3 different factors. Okay. X, Y, and Z. All right. First factor, muscle diastasis. If you have pregnancies, if all that is stretched out, I got to fix it. The second part is going to be your subcutaneous skin. Your subcutaneous fat. If you've got a lot of fat, that's where we make the little incisions and I can suck it out for you. And then the third part, which I say is the most critical part of this whole thing, is your skin quality. Do you have excess skin quality, skin damage, age of the skin itself, all that kind of stuff. And I tell people, I'm like, of all of these factors, your skin is, that's the loose cannon. Like that's the one I can't predict. That's the one that really defines like what type of result we can get you, and that kind of thing. Now, luckily, most people are really, really reasonable, right? Like, the regular plastic surgery patient is just a regular person. It's not somebody who, like what we see on TV on Botched and all this kind of stuff. It's just like people who want to look better, like they just whatever. So a lot of people get that. And so my conversation, whether your BMI is 20 or 30, really comes down to me like doing an exam and looking at your skin, right? Because I have had patients with BMIs of 30 who I can get phenomenal results on. And I've had patients with BMIs of 20 who have 3 kids, and I just tell them, I'm like, look, like we have to do a skin removal procedure. And I think patients really get it when I kind of present it that way, because if I just say like, look, like the liposuction is to treat fat. It doesn't do anything for that third part of the equation. It doesn't do anything for your extra skin. So we got to do a skin procedure if we're going to treat your extra skin. Now, you know, I think one of the things that has really, really helped me move forward is I have a very low threshold to do some sort of skin excision. And like I have a lot of tools in my tool belt where a skin excision doesn't necessarily have to mean it's a full tummy tuck, right? It's not like 0 to 100. It's, you know, maybe we're just doing a little mini C-section scar size, like skin removal to pull that skin tight and, you know, help distribute that fat nice and evenly, right? One analogy I like is, you know, when we do liposuction, we leave fat behind, right? And that's the way it should be done. That's the way you keep the tissue nice and healthy. But it's kind of like taking a big heaping bowl of potato salad. Okay. So if you just scoop a bunch of potato salad in a bowl, it's all chunky and, you know, it looks like whatever. But if you get some saran wrap nice and tight and you just, you stretch it over that top of the potato salad, it looks nice and smooth and contoured, right? So I explain that to patients too.
Some heavy duty saran wrap you have here.
Well, you know,
well, I'm just kidding.
It just
Keep
flattens
going.
everything out, right? So I'm open to suggestions if you got a better idea of.
No, I like that. I think that's a
to,
great analogy. I'm just, you know, I just saran wrap potato salad. It never looks that smooth in my refrigerator. But anyway, but
I don't even like potato salad. So macaroni salad. I don't.
But actually, I do want to follow up if that's okay on.
Yeah.
So yeah, I totally agree with your analogy, by the way. It makes total sense in terms of the skin elasticity. So I get it for someone that's got really bad skin elasticity. You can talk him easily into doing a skin excision. I get it if someone has really good skin elasticity, not really that worried about it as a plastic surgeon. What if someone's kind of in that middle ground? They're sort of, you know, you can kind of tell their skin's going to loosen up a little bit, but they're coming to you and their skin's not that loose yet until it. Is there any role in your practice for things short of doing a skin excision to tighten the skin, whether it's radio frequency or any other sort of energy modality?
Yes. So, so I think, like I said, it all comes down to the skin. So if I even have that premonition of the loose skin, I'm not really sure. Because yeah, exactly like you said, Sam, there's people on both sides, but most people are like in the middle. Most people have had a kid. Most people have some degree of laxity. And so first of all, it's just about like the patient counseling where I just tell people like, look, like, and to answer, like, I promise you, I'm going to answer your question, but I really believe like it's not a one-way conversation of like, this is how I decide it. It's totally like this. It's totally a two-way conversation. That is how you get happy patients for sure, is if you say, all right, here's the deal. You got a little bit of skin. It's kind of loose. After I suck your fat out, I think you may have a little bit of loose skin, but I don't know. Cause I don't know, like everybody's different. Your genetics, you know, your thing. I'm giving you my best guess. If it were me, I would rather do a little bit of a skin excision, pull that skin tight. So I, you know, make sure that we get a nice smooth contour. But if you are like just totally against that and you're okay with having a little bit of loose skin and maybe the contour doesn't look the same, or maybe you've got a little bit of, you know, that kind of thing, then I'm okay doing that too. And I think, that is one thing that like I was not taught in my training. And I don't know if other programs do teach that or not, but like, the way I was taught was like, you really only do liposuction only on people with really, really good skin quality, because those are the only people that are going to have really good results. And, you know, someone with a BMI of 32, you should never really do liposuction on, because like, they're not going to have a good result. They're going to end up, you know, with whatever. And I think that is like something that is just totally wrong, you know, because there are so many people out there who they they're not necessarily looking for, this amazing sculpted, super, results, right? They just want to look better. And if you tell them like, hey, you may have a little bit of loose skin. How do you feel about that? And oh, by the way, like if you do, like we can always come back and cut it off later if it really, really bugs you. A lot of people are like, yeah, that sounds good. Let's do that. Like, and then when they're in my office, I'd say it's 50% get it, 50%, end up healing really well. And that's why I say like, I can't even predict it because like, sometimes I'm like, this patient's definitely going to need, a mini tummy tuck or whatever, a modified tummy tuck, like with umbilical transposition. And then their skin just heals really, really well. So, I love radiofrequency microneedling. I'll say that, for those patients where I'm like, hey, I don't know. So here's a little insurance policy that we can do at the same time that will help us maybe get a little bit of skin retraction. And I like incorporating that for those patients if they're interested in doing it, But again, I just leave it up to the patient. I say like, or don't, it's really up to you. Now, if it's very, very obvious the patient needs a tummy tuck, I'm going to still tell them, I'm going to still give them the same option. And I think that's also something that's, maybe kind of controversial, maybe not. But again, like, I can think of a patient who had a BMI plus 35. And she just was like, listen, I can't take the time off. I can't, I just want to debulk, and that's the word I use. I say like, this is going to be more of a debulking procedure. Right. And I'll tell you, man, some of my happiest patients, they really are. And, and we can still highlight give them some contour, give them some of that shape back. And then those girls like love their results because they have always maybe been kind of like a larger woman, but now they're like a really, really sexy larger woman, and then maybe they come back in a year and they have the time to do the tummy tuck or whatever. So I really do think it's like this sliding dynamic. It's hard to like, create some algorithm in a paper of like, oh yeah, well, BMI here, do this procedure. BMI here, do this procedure. Cause it's really not like, it's really not. It's really like trying to figure out, I know we always like, well, what are your goals? Like we ask the patient, what's your goals? Like, well, and we try to meet that, but like, I don't know how much of us actually really, really listen to that. Right. If I would, because, and the reason I point out is, when I first, started, like got out on my own, I went and I worked for evil corporate plastic surgery. Okay. One of those places that does like liposuction on everybody. Okay. And, when all you have is a hammer, everything's a nail, right? So everyone that walks through the door, liposuction, that's all they do. Like, and I was told like, hey, you gotta do liposuction on this guy. Hey, you gotta do liposuction on this woman. And I was like, man, this is totally different than what I was trained. This is a really bad thing. This goes against everything I've been taught that I'm supposed to do. This patient totally needs, a big, extended tummy tuck with, possibly, whatever. But we would do these liposuction procedures. And again, if you talk to the patients and you kind of tell them what to expect down the road, they're extremely happy. Like, it's like way happier than I could have ever expected. I was like, oh my God, they're going to hate me. I also think like, if you're not somebody who doesn't personally get like care about the feelings of others and stuff, like you're probably not going to be a good plastic surgeon. But like, you know what I mean? Like you got to let your own conscience kind of guide you, right? Like, so I try and I'm like, look, I'm just going to lay it out for you, right? Like you're still going to be big after this. You're still going to have loose skin. Like this is not like some crazy procedure. And they're like, dude, I don't care. I just want to like fit into my pants, Yeah. And you get, and that was a big, like eye-opening kind of thing for me when I did that, because it really did show me that like, we spend so much time saying like, this is the right thing for you. Our science says this is the right procedure. And obviously we have to present that to people. Like, I've done this for a really long time and I can tell you that, this is probably not going to be the best result. But if that person also comes to you and says like, look, well, I can't get 3 weeks off or 2 weeks off for a big mommy makeover procedure. And like, I just really want to get some of this off so I can like, start walking again or start, doing some exercise and stuff like that. Like sometimes it's just, that's the catalyst, right? Like to really get that going.
Well, I think that's really important. I appreciate the fact that a lot of plastic surgeons impose their viewpoint or their opinions on what the aesthetic standard should be, as opposed to presenting the options and letting the patient understand what those options would result in, and then letting them choose what they know for themselves to be their best result, which I think sometimes a lot of plastic surgeons overlook in terms of always trying to achieve what we think would be appropriate. One of my questions I had for you, Chris, was the defining high definition liposuction. So, as opposed to say, like you said, your mother's liposuction, what is it that makes it high definition?
Why do you guys keep talking about
patients,
Pacella's
like you
mom's
said?
liposuction?
Oh, we're gonna start with the mom jokes.
Sorry.
Your mom.
Whoa.
is so-
So if we could get on point, guys, the question is like, is it picking the right patient, like you said, like a fit 60-year-old who's looking to try to get back into shape? Is it doing more aggressive liposuctioning so you're actually seeing the underlying musculature, or is it more of a etching where you're sort of working a technique to highlight the anatomy better by a specific technique of liposuction?
Absolutely, all of the above. So, when you're saying like, what is like, if someone comes in and says, am I a candidate for high def liposuction? I think, is that kind of another way to rephrase it?
Yeah. How are you doing it? How do you?
Yeah. So,
yeah. What makes it high def versus regular light?
So it's more, Hoyos wrote a paper a year or two ago, and he just came out with another one that's like kind of similar, where he, basically kind of defines like the different degrees of definition, and the way he kind of structured that paper, I think is the way that I kind of talk to a lot of my patients. I don't call people endomorphs or ectomorphs or, what I just say, like, number one, everybody coming in my office for liposuction, I'm assuming they're coming in because they've like seen my results, and like they're coming in because they want some degree of definition. So it doesn't matter if I'm doing a very obese person, I'm still going to try and get them some highlights in the linea alba and the semilunaris lines, right? Like, I'm still, the key though is like, you can't just draw them on there. Okay. You've got to look at the patient's torso, because someone who's got a 40-inch circumference chest, their rectus muscles are just going to be wider. And so if you try and paint them on there like you would for a 5'2" petite Asian woman or something, like it's not going to work. Right. So again, like highlighting their natural anatomy, I have them literally like stand and flex, like I tell them, I'm like, flex like you're trying to show me your abs, and I just push on them and I try and feel where that is. So it's not like a stencil where you can just like stick it on there and then like draw inside the lines, right? Like, so I think you can do these techniques in every single patient. Now, if to that degree, if a patient who is, let's just say, overweight, with some loose skin comes to me and says, I'm looking for a high def result, I'm going to say, well, number one, like, what do you mean by that? Right. And have them show me some pictures. And again, like when they show me those pictures, a lot of them they're showing me natural results. They're not showing me like the true high def etched out 6-pack, 8-pack with serratus definition and the external obliques coming off of the rib cage. Like that's like an extreme high def, right? And that type of patient tends to be it's kind of self-selecting, right? Like that tends to be somebody who's already in shape. So
Can I ask a question?
Yeah.
As you're doing this? So are
Yeah, of
you
course.
using traditional lipo, energy modalities, power assisted? Like, how are you achieving these different degrees of definition?
Ooh, all right. All the industry people hate me, because I don't believe that this, and I think this is super important for your audience to hear. Do not associate a result with a device. Okay. Whatever that device is out there, like, we get called, at least a few times a week asking, hey, do you guys have, I saw Dr. Costa's liposuction. Does he use the X, the whatever device, does he do X? I'm not saying any names. You know what I mean? And I've literally had to have hours of conversation coaching my staff of how to navigate that, because your result is based on, proximal to the instrument, right? So if you put me in a pair of Air Jordans and make me play basketball against Michael Jordan in flip-flops, he's still gonna whip me pretty hard, right? Like it's not the device, it's not the shoe. It's the surgeon.
It's always the surgeon.
And from the surgeon's standpoint, it's, again, like if you're a surgeon, there's so many people who, like I saw during training, and I've seen, just out in the community, who they go through the steps and then they're done, and they never sit there and like critically analyze their own result on the table. Like, it's just like, well, I did it. The fat's in the canister. We're done. Like, yeah, I got 3 liters of fat out. Like, what? That's a great endpoint. And at no point are they actually looking at the patient, feeling the patient, doing skin pitchness tests, like, feeling to make sure that contour is nice and even, right? So do we have those devices? The answer is yes. And I do use them when appropriate, but I don't necessarily think that, any device actually makes the surgeon. Ironically, I have 2 micro airs in my office because I do a lot of awake liposuction. And the reason I have 2 micro airs is because the piece is you can take the tip off, right? And I can fit it in my tabletop autoclave. That's the only reason I have it.
Okay.
Chris,
it's not because I feel like it's a better thing.
Just a question. Okay. So you mentioned very eloquently how you would talk to a patient. Your conversation is very two-sided, and you mutually decide on a procedure. So let's say, for example, you think the patient needs a more advanced procedure, full tummy tuck, liposuction, etc. The patient says, no, I can't take the time off. I'm just going to do a little bit of skin incision. I'm not going to tighten up the rectus muscles. I want to do something that you feel is not necessarily the best. You do the procedure.
Yeah.
And then they're unhappy. How do you handle that?
So again, my experience has been that most people are like reasonable and normal. Like most people are normal, right? So I can have an unhappy patient, but if I sit with them and I say like, yeah, remember we talked about all this? Like that's the loose skin that I was talking about. And remember how you said you couldn't take 2 weeks off work? Oh yeah. Okay. Like most people get it. Like people are not dumb. Are there the people out there who are just mean, angry people when they're going to be mad? Yeah, we try not to operate on those people. You know what I mean? And I think that's a big key part is, it's not, if in that part of that two-way conversation is, the patient interviewing me, but me interviewing the patient too, is like, does this person like get it? Right? Like if they do not get it, and the way I can tell a patient doesn't get it is because, they start trying to negotiate with me, right? Like they start saying like, well, it's like, it's like, it's one or the other. It's either we cut the skin off and I get you the best result and we pull it tight, or we just do more of like a debulking procedure and we try and get you smaller and just, one step along the way. Well, can't you do that and get me the result that and like when I'm having that conversation, I'm like, we lay it out very, very clearly. No, it's one or the other. It's not both. And, if I feel like they're not getting it, I will then say like, I don't think this is probably the right procedure for you, or I don't think I can get you this, the results that you want. You should maybe go see somebody else. But the advantage is, I don't know how long your guys' consults are. I know you guys all do really, really good work. But there is that is part of the advantages. I get to interview the patient also and, make sure that they're somebody who, when they do come back and they have that result, that like, we're like 100% clear about what the goals and expectations were. And like I said, like no, most people aren't going to like come after you because, most people get it. Like,
No.
So so when that does happen, let's just say it does happen, we've laid all the groundwork now to kind of lay that out to them. And to, the other thing that's really nice is like, I have lots of really, really great results on my website, but I have some results on my website that I kind of like hide at the bottom. Okay. And the reason I hide them at the bottom because they're not the ones I really want to highlight, but they are there in case, I have somebody who like, I feel like isn't getting it. Cause then I can show them, hey, this is somebody who should have gotten a tummy tuck. And I really recommended it to them, but they decided that like, they just want to do liposuction, and here they are. And you can see that they're smaller and they have, that crepey looking skin now. And it's, and this is their result, but they are super, super happy because I gave them, like, we had that conversation and we talked to them and I said, so are you going to be happy if you get a result like this? Like, and that's how I turned. Yeah.
You know what I love about that, Chris? The first thing is I think it is obvious for all of us as experienced plastic surgeons. It's not about figuring out who to operate on. It's figuring out who not to operate on. And the farther along you go, you figure that out and you avoid these situations as best you can to make sure you're a good match with the patient. The second thing I love about your answer is that you are honest. You don't just put everything that looks glam and awesome on there. You're putting other
all body shapes,
other results that right. And to me, that's the mark of a real plastic surgeon, is someone who's very honest, who can show a variety of results and is not sitting there insecure about like, oh, I only have to like pretend that everyone is like a model, an Instagram model that comes out of my practice. And I think that honesty is something that I just thought about myself. Like, you know what? That I could probably take some lessons away from that myself.
And I think that brings us.
I can't tell you. Yeah.
I think that brings us to our last question, Chris. A very important question. Yes or no answer. Okay. Does what happens in Vegas always stay in Vegas?
No. Definitely not. But,
yes or no?
But it definitely doesn't. But I promise you, if you come out, we'll have a good time. Yeah. We'll have a good time for sure.
Well, I think well, Chris, we really want to thank you for your time. I think you've hit some really points for our viewers. High definition liposuction is not one catch-all operation. It's the surgeon that determines it. It's not really how big you are. It's all of the various anatomic factors that determine how great of a result you'll get. So thanks for illustrating those points. Been super, super instructive. We really appreciate your time.
Good seeing you again,
Yeah,
Chris.
thanks. Hopefully my perspective was refreshing a little bit. Just a reminder, I'm in Las Vegas, Nevada, Platinum Plastic Surgery. We just opened our new office with our new surgery center too. So if you're around, come check us out. And
I'm totally going to check
out our new place
next time I'm there for sure.
Very cool.
All right. Thanks again, gents.
All right.
Take care. Thanks, Chris.
Thank you, Chris.